Diabetes is characterized by the presence of persistently elevated blood sugar levels. Early-stage diabetes often presents with minimal or no noticeable symptoms. Due to the lack of early symptoms, timely detection is crucial for effective diabetes management. Effective management of diabetes requires early detection to mitigate long-term health complications. Elevated blood sugar levels trigger increased thirst as a physiological response. The body attempts to dilute the high glucose concentration in the blood through increased fluid intake. Increased fluid intake is a direct consequence of the body's attempt to restore osmotic balance. This compensatory mechanism aims to maintain homeostasis in response to hyperglycemia. The kidneys filter blood and expel waste products, including excess glucose. Elevated blood sugar levels force the kidneys to work harder to maintain balance. Increased urination, especially at night, is a result of the kidney's efforts to remove excess sugar. The kidney's compensatory mechanism leads to frequent urination as they filter more fluid. This process helps regulate blood sugar, but can strain kidney function over time. The body may lose weight despite adequate food intake. Weight loss occurs because the body cannot effectively utilize glucose for energy. Inefficient glucose utilization forces the body to break down fat reserves. Muscle tissue is also broken down as an alternative energy source. The breakdown of fat and muscle leads to a decrease in overall body mass. This metabolic shift represents a failure in the body's ability to process glucose effectively. Energy deficiency occurs when the body's cells are deprived of glucose. Glucose deprivation leads to general sluggishness and fatigue. The primary cause of sluggishness and fatigue is a lack of energy at the cellular level. Cellular energy deficiency impacts overall bodily functions and vitality. Insufficient glucose supply to cells results in reduced ATP production, the primary energy currency. Energy deficiency can be mitigated by ensuring adequate glucose supply to cells. Persistently high blood sugar can cause swelling of the eye's lens. Elevated blood sugar levels can damage the blood vessels in the retina. Damage to retinal blood vessels leads to blurred or decreased vision. These changes in the eye can lead to vision impairment. Elevated blood sugar levels can cause damage to nerves throughout the body. Nerve damage often manifests as numbness, pain, or loss of sensation, particularly in the hands and feet. This condition, resulting from nerve damage due to high blood sugar, is known as neuropathy. Peripheral neuropathy affects the peripheral nerves, which transmit signals from the brain and spinal cord to the rest of the body. Effective blood sugar management can help prevent or slow the progression of nerve damage and associated symptoms. Diabetes can weaken the immune system, increasing susceptibility to various infections. A weakened immune system can manifest as dry, itchy skin. Athlete's foot is a common fungal infection that individuals with weakened immune systems are more prone to. Candidiasis, another infection, is also more likely to occur when the immune system is compromised. The body's defense mechanisms are less effective when the immune system is weakened. Maintaining healthy blood sugar levels is crucial for supporting a robust immune response. Elevated blood sugar impairs blood circulation, hindering the delivery of essential nutrients and oxygen to wound sites. High glucose levels weaken the immune system, reducing the effectiveness of immune cells in fighting off infections at the wound. Impaired blood circulation and a weakened immune system collectively slow down the healing process of even minor wounds. Reduced nutrient supply compromises the formation of new collagen, a critical component for wound closure and tissue repair. Inefficient immune response increases the risk of infection, further delaying the healing process and potentially leading to complications. The combined effects of impaired circulation and weakened immunity create a challenging environment for effective wound healing. Diabetes can negatively impact various bodily functions. Diabetes is a potential risk factor for erectile dysfunction, ED. Erectile dysfunction is a common sexual health issue. Diabetes can affect blood vessel and nerve function, contributing to ED. Managing diabetes can help mitigate the risk of sexual health complications. Consulting a healthcare professional is crucial for addressing diabetes-related sexual health concerns. The simultaneous appearance of multiple diabetes symptoms necessitates immediate medical consultation. Elevated blood sugar levels detected through testing also warrant prompt medical evaluation. Early diagnosis and treatment are crucial for managing diabetes and preventing complications. Medical professionals can provide accurate diagnoses and personalized treatment plans. Ignoring diabetes symptoms can lead to severe health consequences. Timely medical intervention is essential for maintaining optimal health and well-being. In its early stages, cancer often exhibits few noticeable symptoms. Cancer is frequently detected during routine health checks, highlighting the importance of regular screenings. Vigilance and proactive health monitoring are crucial for early cancer detection. Early detection significantly improves treatment outcomes and survival rates. Rapid, unexplained weight loss, especially without dieting, can be an early warning sign. Unintentional weight loss may indicate underlying health issues requiring medical evaluation. Cancer is a potential cause of unexplained weight loss, prompting the need for timely diagnosis. Medical evaluation is crucial to determine the cause and implement appropriate treatment strategies. Unexplained, persistent fever or night sweats, without signs of other illness, can be indicative of an underlying cancerous condition. Persistent fever, in the absence of infection, suggests the body's immune system is reacting to an unknown stimulus. The body's inflammatory response, triggered by cancerous cells, can manifest as a persistent, unexplained fever. Night sweats are triggered by hormonal changes or substances produced by cancerous cells, disrupting the body's temperature regulation. Chronic fatigue that persists despite adequate rest warrants medical investigation. Persistent fatigue, even after sufficient rest, can be a symptom of underlying health issues. Unexplained, prolonged fatigue may indicate the presence of cancer. Medical evaluation is crucial to determine the cause of chronic fatigue and rule out serious conditions. Early detection and diagnosis are vital for effective cancer treatment. The appearance of hard lumps requires prompt medical attention. Swelling in areas such as the breasts, neck, armpits, testicles, or groin requires prompt medical attention. Early detection through medical examination is crucial for addressing potentially serious underlying conditions. Ignoring unusual lumps or swelling can lead to delayed diagnosis and treatment. Consulting a healthcare professional ensures timely evaluation and appropriate medical intervention. Persistent changes in bowel habits can be an indicator of underlying health issues. Constipation, characterized by infrequent bowel movements, is one such change. Conversely, diarrhea, marked by frequent and loose stools, is another significant change. Thin stools, also known as pencil stools, represent a change in stool caliber. The presence of blood in the stool is a critical symptom that warrants medical attention. These persistent changes, while not always indicative of cancer, necessitate thorough medical evaluation. The presence of blood in urine warrants immediate medical evaluation. Changes in urinary habits or appearance should not be overlooked. Ignoring urinary changes can lead to delayed diagnosis and treatment of underlying conditions. Prompt medical evaluation is crucial for accurate diagnosis and timely intervention. Difficulty swallowing or dysphagia can manifest as the sensation of food being stuck in the throat. Dysphagia can be a symptom of underlying health issues affecting the digestive system. Cancer affecting the digestive tract can cause difficulty in swallowing. Tumors in the esophagus can physically obstruct the passage of food. Esophageal cancer can disrupt the normal muscle contractions required for swallowing. Early detection and diagnosis are crucial for managing dysphagia related to digestive cancers. Persistent stomach discomfort or abdominal pain, without a clear cause, requires medical investigation. Medical investigation is essential to determine the underlying cause of unexplained abdominal pain. Diagnostic procedures may include imaging tests to visualize internal organs and identify abnormalities. Endoscopic procedures allow direct visualization of the digestive tract to detect inflammation or lesions. Laboratory tests can help identify infections, inflammation, or other systemic conditions contributing to abdominal discomfort. Early diagnosis and appropriate treatment can improve outcomes and prevent complications associated with persistent abdominal pain. Bleeding outside of regular menstruation requires medical evaluation. A healthcare professional can diagnose the cause of irregular bleeding. Early evaluation ensures timely management and treatment. Various factors can contribute to irregular bleeding, necessitating professional assessment. The presence of blood in bodily secretions is a critical warning sign. Blood in stool warrants immediate medical evaluation. Blood in urine is a serious symptom requiring prompt attention. Bloody cough or nipple discharge also necessitates urgent medical consultation. A persistent cough necessitates medical evaluation to identify potential underlying causes. Bloody sputum requires investigation to rule out serious conditions, including cancer. Medical assessments are crucial for differentiating between benign and malignant causes of respiratory symptoms. Early detection and diagnosis improve treatment outcomes for underlying conditions associated with persistent coughing. Changes in the color of a mole can be an early indicator of skin cancer. Alterations in the size of a mole may signal potential skin abnormalities. Modifications in the shape of a mole can be an early warning sign of skin cancer. Monitoring moles for changes is crucial for early detection and treatment of skin cancer. Skin sores that do not heal require prompt medical evaluation. Bloody skin lesions should be examined by a healthcare provider. Early examination of skin lesions can aid in diagnosis and treatment. Unhealed skin sores may indicate underlying health conditions. Prompt medical consultation is essential when symptoms arise. Ignoring symptoms can lead to delayed diagnosis and treatment. Simultaneous occurrence of multiple symptoms warrants immediate medical attention. Early symptom awareness facilitates timely intervention and improved health outcomes. Consulting a doctor ensures an accurate diagnosis and appropriate medical guidance. Regular health checks are strongly recommended for maintaining overall well-being. Specialist consultations are advised for individuals experiencing specific or persistent health concerns. Unusual discomfort should prompt a comprehensive medical evaluation. Experiencing multiple symptoms simultaneously warrants a thorough health assessment. Early detection through regular health checks and specialist consultations can improve treatment outcomes. Regular blood sugar monitoring is crucial for effective diabetes management. Consistent monitoring aids in the early detection of diabetes. Blood sugar levels provide essential data for personalized diabetes treatment plans. Monitoring helps individuals understand how diet and exercise affect their blood sugar. Hemoglobin A1C, HbA1c, testing provides an average of blood sugar levels over the past 2-3 months. HbA1c testing is crucial for effective diabetes management. The HbA1c test reflects the percentage of hemoglobin proteins in the blood that are glycated. Regular HbA1c testing helps healthcare providers adjust treatment plans and improve patient outcomes. Diabetes can cause damage to blood vessels throughout the body. Nerve damage is another potential complication of diabetes. Unmanaged diabetes can lead to irreversible health consequences. Early detection and management are crucial for preventing long-term complications. Early action upon symptom onset can significantly improve long-term health outcomes. Prompt medical intervention can mitigate the progression of diseases. Timely diagnosis facilitates more effective treatment strategies. Immediate response to health concerns can prevent complications and reduce severity. Acting quickly can maximize the benefits of preventative care. Early intervention often leads to reduced healthcare costs and improved quality of life. Lifestyle changes, including diet and exercise, are critical in managing diabetes. Dietary modifications help regulate blood sugar levels and reduce the need for medication. Regular exercise improves insulin sensitivity and aids in weight management for diabetic patients. Consistent lifestyle adjustments can significantly improve long-term health outcomes and quality of life for individuals with diabetes. Medical interventions are frequently required for effective diabetes management. Medication is a common medical intervention used to regulate blood sugar levels in diabetic patients. Insulin therapy is a critical intervention for patients whose bodies do not produce enough insulin. Medical interventions aim to maintain stable blood glucose levels and prevent long-term complications associated with diabetes. Regular cancer screening is vital for early detection. Early detection significantly improves treatment outcomes. Cancer screening aids in identifying potential health issues before symptoms arise. Consistent screening schedules are recommended based on individual risk factors and medical history. Self-examination techniques, including breast and testicular exams, aid in the early detection of cancer. Regular self-exams can help individuals become familiar with their bodies and identify any unusual changes. Early detection through self-examination improves the chances of successful treatment and recovery. Self-examination should be performed regularly and supplemented with professional medical checkups for comprehensive care. Understanding personal risk factors for cancer enables informed decisions regarding screening and prevention. Identifying individual risk factors is a critical step in proactive health management. Knowledge of risk factors empowers individuals to take control of their health through lifestyle adjustments and regular checkups. Personalized screening plans, tailored to individual risk profiles, enhance the effectiveness of early cancer detection. Proactive cancer prevention strategies can significantly reduce the likelihood of developing the disease. Genetic factors can elevate an individual's susceptibility to certain types of cancer. A comprehensive family history is crucial in assessing cancer risk due to inherited genetic predispositions. Inherited genetic mutations can disrupt normal cellular functions, leading to uncontrolled cell growth and tumor formation. Genetic testing can identify specific gene mutations associated with increased cancer risk. Understanding genetic predispositions allows for proactive screening and personalized preventative strategies. Environmental factors, including exposure to toxins, can contribute to cancer development. Radiation exposure is another environmental factor linked to increased cancer risk. The cumulative effect of environmental exposures over time increases the likelihood of cellular mutations. Minimizing exposure to environmental toxins and radiation can reduce cancer risk. Protective measures, such as air purifiers and radiation shielding, can mitigate the impact of environmental factors. A diet rich in fruits and vegetables can significantly reduce the risk of cancer. Fruits and vegetables contain essential vitamins, minerals, and antioxidants that protect cells from damage. Antioxidants neutralize free radicals, unstable molecules that can cause cellular damage and contribute to the development of cancer. Specific compounds in fruits and vegetables, such as flavonoids and carotenoids, have demonstrated anti-cancer properties. A balanced diet supports overall health and strengthens the body's natural defenses against disease. Incorporating a variety of fruits and vegetables into daily meals is a proactive step towards cancer prevention. Regular exercise helps maintain a healthy weight, reducing the risk of certain cancers. Maintaining a healthy weight through exercise reduces the risk of cancers associated with obesity. Exercise promotes metabolic health, which can prevent cancer development by regulating hormones and reducing inflammation. Consistent physical activity strengthens the immune system, improving the body's ability to fight off cancerous cells. Avoiding tobacco use is a highly effective method for reducing cancer risk. Tobacco contains numerous carcinogens that directly damage DNA and cellular functions. Quitting tobacco use allows the body to begin repairing cellular damage and reduces further exposure to carcinogens. Reduced tobacco use correlates directly with decreased incidence rates of various cancers. Comprehensive prevention strategies include public awareness campaigns and accessible cessation programs. Adopting a tobacco-free lifestyle significantly improves overall health and longevity. Limiting alcohol consumption is associated with a reduced risk of developing certain types of cancer. Alcohol consumption can increase the risk of cancers, such as liver, breast, colon, and esophageal cancer. Reducing alcohol intake helps to minimize cellular damage and DNA mutations that can lead to cancer development. Lower alcohol consumption can improve the body's natural defense mechanisms against cancer cells. Maintaining a healthy lifestyle, including limited alcohol, supports overall well-being and reduces cancer risk. Adopting responsible drinking habits is a crucial step in cancer prevention. Protecting skin from excessive sun exposure can help prevent skin cancer. Sunscreen application is a primary method for protecting skin from harmful UV rays. Protective clothing, such as hats and long sleeves, provides a physical barrier against sun exposure. Seeking shade during peak sun hours reduces direct exposure to ultraviolet radiation. Vaccination can provide protection against viruses that are known to cause certain types of cancer. Human papillomavirus, HPV, is a virus that can lead to various cancers, including cervical and oropharyngeal cancers. HPV vaccination significantly reduces the risk of developing HPV-related cancers. Vaccination is a proactive measure for cancer prevention. Understanding available cancer treatment options empowers patients to make informed decisions. Surgery involves the physical removal of cancerous tissue and may be used alone or in combination with other treatments. Chemotherapy utilizes drugs to kill cancer cells throughout the body, often administered intravenously or orally. Radiation therapy uses high-energy rays to damage cancer cells, preventing them from growing and dividing. Support groups offer emotional support for individuals affected by cancer. These groups serve as a valuable resource for cancer patients and their families. Sharing experiences within a support group can reduce feelings of isolation and anxiety. Support groups provide a safe space for open communication and mutual understanding. Participating in support groups can improve overall well-being and quality of life for those affected by cancer. Maintaining good mental health is crucial for overall well-being. Mental health significantly impacts physical health, especially during illness. Positive mental health practices can improve recovery outcomes. Seeking support and practicing self-care are vital components of mental well-being. Ignoring mental health can lead to prolonged or worsened physical health conditions. Early detection of diabetes significantly improves treatment outcomes. Early detection of cancer leads to better quality of life for patients. Early detection allows for timely intervention and management of both diseases. Proactive screening and regular checkups are crucial for early disease identification. Improved treatment outcomes and enhanced quality of life are the key benefits of early detection. Proactive health management involves taking personal responsibility for one's well-being. Seeking medical attention promptly when health issues arise is a crucial aspect of proactive care. Early detection and intervention can significantly improve health outcomes. Regular checkups and screenings play a vital role in identifying potential health risks. Adopting healthy lifestyle habits contributes to overall wellness and disease prevention. Empowering individuals with health knowledge promotes informed decision-making and better health management. Recognizing early warning signs is crucial for safeguarding future health. Early detection enables timely intervention and management of potential health issues. Addressing health concerns proactively contributes to overall well-being and a better quality of life. Protecting one's health involves awareness, vigilance, and proactive engagement with healthcare resources.